Okay, clicker or keypad, doesn't matter. Again, Jen Amos with Encounter Telehealth. We partner with skilled nursing facilities to provide behavioral health care for their residents in need. And of course, we do so over VSee. Before I start to talk about the company, I'd like to just go over the larger picture of mental health and mental health care in America. I think it's going to be a little bit of just a quiz to see if you've been listening to the other speakers, because most of this has already been covered. There are over 65 million Americans who suffer from a diagnosable mental health care or mental health illness, in America. That is 25% of our fellow citizens. I would like to ask you if anyone knows how many providers we actually have practicing in this country to meet that demand. Not enough. Thank you very much. Any other guesses? No? Well, we need over 100,000 psychiatric providers to provide that care. Now, how many do we have other than not enough? You guys know. We don't even have 40,000, and that includes both psychiatrists and psychiatric mental health nurse practitioners. When you look in our rural communities, it's worse. It's not even 50%. It's about 20 to 25% of those providers might be practicing. So what we see here is over 30 million Americans not receiving that specialized care that they need. It's really, it's a national crisis. It's horrific. So we at Encounter, we focus on partnering again with skilled nursing facilities. They're just one of a number of long-term care facilities that are taking care of Americans with behavioral health illnesses. Total, that would be 18 million people. Looking at it another way, it's a $50 billion market. We're at SNFs, which is just 6% of that, and we're okay with that. So speaking of those skilled nursing facilities, can anyone guess the percentage of residents that have a diagnosable mental health illness? Come on. 75? Okay, I like that. A little higher, it's 85%. And there's actually only one other long-term care community with a rate that high. This is my last question. Can anyone guess what communities that might be? Yes, thank you, corrections. So it's horrific. We have a lot of people that really do need this care. So what are we doing about it? Well, we are bringing the specialist to the patient, wherever he or she may be. Again, we do that over VSee. We operate primarily in states with very large rural populations. Our network of providers are made up primarily of board-certified psychiatric mental health nurse practitioners. So we also operate in states that are mainly full practice or reduced practice for those individuals. That means that they can diagnose, treat, prescribe without MD authority for the most part. Actually, the Pacific Northwest should be green on here as well, as we've just entered into those states. So a little bit more on our providers. Our psychiatric nurse practitioners, these are individuals with doctorates or masters in nursing who go on to specialize and be certified in psychiatric mental health care. They work as independent contractors with us. We do have a medical director who has a psychiatrist who has oversight of them, but again, for the most part, they are able to diagnose, treat, prescribe for their patients individually. Now, because our healthcare is delivered remotely, we have some really key must-haves in the providers that work with us. The first is they have to take ownership of their practice. We really consider ourselves the back office for them so they can focus on what they do best, which is patient care. They need to be really comfortable delivering care over video, and I think Dr. G was in here a second ago, but she just left. I wanted to talk to her about that a little bit more. We actually have had some individuals who just started with us one day and were very, very uncomfortable over camera, so it's important to be able to meet that. Another would be they have to have some business development DNA. They're working directly with the facility staff to identify residents in need of specialized mental health care. And then finally, they really have to have a collaborative spirit. We work very closely with the staff in those nursing facilities to share status updates on what's transpired with the patient since last seen, for medication reconciliation, as well as sharing of those vitals, which is very important in the types of encounters we do. So I think maybe of more interest here is what is it like working with rural or those skilled nursing facilities. We do focus on facilities in rural communities, and this is mainly because there just are no specialists in these places. We usually are the first psychiatric specialist that one of these patients or one of these residents has seen. There also are geographic constraints due to the fact that the closest provider could be hours away. And the flip side of that is that it's very difficult to convince a provider to travel to one of these facilities. Our patient population is really complex. A lot of the individuals we see have Alzheimer's or other related dementias that require a healthcare provider to be on both sides of the screen. A lot of individuals with multiple chronic conditions that leads to really complicated medication management. And then finally, we are working with individuals with severe mental illness, schizophrenia, bipolar disorder, major depression. We need ongoing care to really ensure the efficacy of that treatment. So what does that mean? Well, we do have some challenges that I think are specific to the skilled nursing facility space. As I mentioned, we have very complicated patients that require care on both sides of the camera, so we have to have buy-in from the entire staff. It's key. Now, the no-show rates are pretty low, but when we do see them, it tends to be because the facility staff is double booked, or maybe they actually were the no-show themselves. IT knowledge, this is really interesting. In corporations that we work with, they tend to have very robust IT departments. Sometimes we work with independent facilities, and we jokingly say that the IT department is the janitorial staff. And it actually is not a joke, it's true. The main IT problems we tend to have are how to log in, how to log in. And then finally, stigma of mental illness. We see this mainly from family members. Again, we're working in rural communities, and as it's starting to alleviate a bit, but we still do get a little pushback from that. So how do we deal with it? When we are working with facilities to decide whether we partner with them, we are really screening them to ensure there's going to be that buy-in. We know that mental health is vital to physical health, and so that facility, the entire staff really needs to share that view of total patient care. We also need them to share a very conservative view of medication. We like to reduce or eliminate as much as possible the use of medication. Especially, we see a lot of off-label use of the psychotropic drugs for individuals with dementia. So we like to try and alleviate or remove those. And then again, very comfortable over delivery of healthcare over video. Again, we have some individuals who don't know how to log into their computer, so we work with them on that. And then finally, really, the staff engaging the family members on mental health care. Very key that we educate them into the importance of this. So I will just wrap this up with a couple comments on what we expect moving forward. We definitely have seen a marked growth in the acceptance of mental health care among family members, patients, and also staff. Administrators in particular are really focused on removing any admissions or readmissions to the ED. They also like to see a reduction in all the costs that are not reimbursable, such as transporting a patient off-site to see a specialist. The demand for specialty care has definitely increased. Wound care, dermatology, ophthalmology. So we're working with all of our skilled nursing facility patients right now to see how we can provide those services. And then finally, access to care. And that really is just based on technology. Improvements in technology, decrease in the cost, and we are able to improve access to all of these individuals. So that's it. Thank you.
Thank you so much. I have something.
How do you get your revenue? Do Do you bill insurance? Do you
Oh, yeah,
bill
great
us?
question. So we are certified providers. We bill insurance directly. Medicare is our main payer. We also do bill the facilities that we work with a nominal access fee. Medicaid as well, yes. And Medicare, so we only work with nursing facilities that are in rural communities. We can't work with, well, we can't be reimbursed by Medicare for facilities within metropolitan statistical areas.
He just asked my question, but thank you.
Okay.
Because we heard from the Noridian Medicare lady that it's only shortage areas, rural areas, and what was the other one?
So outside of
Health.
metropolitan statistical areas, MSAs.
So your skilled nursing facilities in other places would not qualify?
Nursing facilities in rural areas that, yes, they're HIPSA? Yeah.
Hello, thank you. Just wondering, having done some telepsychiatry in the past, especially with the elderly population, there might be some hard of hearing or low hearing acuity. Just wondering how you overcome that with the video.
The large majority need to be facilitated. The large majority of encounters are facilitated by the nursing facility staff. Oh, Dr. G's back. I mentioned you. I'll come find you afterwards. You want mine?
Thank you. Okay. So excellent. This is fascinating. I appreciate that we're providing services in the rural areas. So my question has to do with compliance. And as a psychologist working in skilled nursing facilities, it's sometimes challenging to get clients to accept having a mental health provider because more so with men, they don't need to see a psychologist or a psychiatrist. So I was wondering with the telepsych technology, are they more easily able to adapt to that, or is it more of a challenge? Because I could see it going either way.
Yeah, that's a really interesting question. I'm going to answer it in a couple different ways. So one of the big questions we get is because we work with skilled nursing and we're working with the geriatric population, are they accepting of the technology? And actually what we find, they love it because there's an individual who is genuinely interested in their well-being coming to visit them. And so they kind of see it as, this is Skype. I'm Skyping with my grandkids kind of thing. It's cool, yes. And I forgot the other part, that compliance. Yes, sorry, say again.
Even accepting it, adopting to that, being willing to consent to that.
Yeah.
So sometimes the first challenge. So I didn't know if the technology would make it even more of a barrier for some people, or
Right.
or less.
Right, and so, well, this is a bit of a side note, but there have been studies done about telepsychiatry, the efficacy of mental health care over a telehealth platform, and there have even been studies done on eye connection, and that there's a higher increase of it when those services are delivered over telehealth. So it's almost as if this screen gives them some comfort. Yeah, I don't think we see that as much in the geriatric population as you could probably identify it in the adolescent or adult population, and the only pushback we really get is from family members when the kind of the stigma comes up.
Thank you so much for that. Thank you so much for a great talk.
Thanks, Milton. Thank you for having me.
Thank you.